Welcome to The Explainer. Today, we're going to break down one of the most crucial skills you'll ever learn in nursing. This is a method that will seriously help you act with confidence and clarity no matter what's thrown at you.
Okay, let's start with a scene that I am sure you know all too well. You're on a busy ward, right? The buzzers are going off, people are rushing around, and you need a solid way to assess any patient fast. So, how do you do it? How do you cut through the noise? Well, luckily, you don't have to just wing it. There's a proven tool for exactly this situation. It gives you a structure, a kind of roadmap to follow right in the middle of all that chaos. And that tool is the A to G assessment. Today, we're going to walk through it step by step. Honestly, this skill is going to become your gold standard. It's how you bring those emergency principles into your everyday care, and it's your absolute best bet for spotting a patient who's starting to get sick before it becomes a full-blown crisis. Okay, let's dive right in. We're going to start with the most critical, life-sustaining checks. These first four steps, A, B, C, and D, are your immediate priorities. Why? Because they deal with the things that can pose an immediate threat to life. First up, A is for airway. And a really simple way to check this is, can the patient talk to you? If they can chat in full sentences, that is a fantastic sign that their airway is open. But you've got to use your ears too. Are you hearing any rattling, any gurgling sounds, or snoring? Because a blocked airway is problem number one, and you have to solve it before you do anything else. And if you do find a problem, you have to act immediately. Sometimes something as simple as sitting the patient upright can make a world of difference. But here's the most important thing. You have to know when to get help. A threatened airway is a medical emergency. You need to escalate fast. Okay, airway is clear. Next, we move on to B for breathing. You're going to use the old look, listen, and feel technique here. Look at their chest. Is it moving evenly? Are they working hard to breathe? Listen for any sounds, like wheezing. And of course, you're getting those vitals. Count their respiratory rate for a full minute and check their oxygen sats. Remember, a normal rate is somewhere between 12 and 20 breaths a minute. Now, there are a few critical warning signs you absolutely cannot miss. If you see the patient using the muscles in their neck or their stomach to breathe, or if they look sweaty or a bit blue, those are massive red flags that they're in significant respiratory distress. So what do? Well, you can give them oxygen based on local policy. You can sit them upright to help open up their lungs. And if they have prescribed inhalers, you can help with those. But just like with the airway, if you see any signs of severe distress, you escalate. Get help right away. C is for circulation. And this is about way more than just checking a pulse. We're looking at the whole system. Yeah, you check their heart rate and their blood pressure, but you also need to look at them. What does their skin feel like? Are their hands warm and pink? Or are they cold and clammy? That tells you a whole lot. And a really neat check here is the capillary refill time. It should be less than 2 seconds. That tells you that blood is getting to their fingertips effectively. It's super simple. Just give their fingernail a gentle squeeze till it turns white, then let go. If that pink color doesn't pop back in under 2 seconds, it might be a sign of poor circulation. If you're worried about circulation, your priorities are getting IV access and managing any fluids or bleeding. Getting that IV access early is a total game changer because it gives you a direct line to give fluids or drugs if things get worse. Okay, let's move to D for disability. Now, don't let the word throw you. We're not talking about long-term disabilities here. This is all about their neurological status right now. How conscious are they? Are their pupils reacting? Is there any new confusion or agitation? And the best tool for this is the ACVPU scale. It's so fast and simple. A is for alert, C for new confusion, V for response to voice, P for response to pain, and U for unconscious. And let me tell you, that C for new confusion is so important. It's often one of the earliest signs of deterioration, and it's really easy to miss. Any change you notice on that ACVPU scale requires you to act fast and escalate. If someone's level of consciousness suddenly drops, that's a medical emergency, and your first thought has to be to protect their airway. A really common cause for this, by the way, can be low blood sugar, which we're going to get to in just a minute. All right, deep breath. We've covered the immediate life threats. Now we're going to broaden our assessment to get the full picture. E, F, and G are all about adding that crucial context and seeing the patient as a whole person. E is for exposure. This means you're doing a head-to-toe inspection. You're looking for rashes, bruises, pressure sores, anything you might have missed. You're also checking their temperature. And this is so important. You have to do this while keeping your patient warm and always maintaining their dignity and privacy. F stands for fluids. This is all about checking their hydration status. Think of it like a simple balance sheet: what's going in versus what's coming out. You're checking for any signs of dehydration, and you're keeping track of any nausea or vomiting. Your best friend here is an accurate fluid balance chart.
G starts with glucose. Remember when we talked about D for disability? Well, this is often the cause. An abnormal blood sugar can make someone suddenly confused or drowsy. You're checking to see if their blood glucose is too low, which we call hypoglycemia, and treating it right away according to your local guidelines.
But G also stands for, well, getting everything else. It's about getting the whole story. You need to look at their medical notes, sure, but you also need to talk to their family and friends. And you need to do a social assessment. Who do they live with? What's their home like? This holistic view is absolutely vital for providing great care and for planning a safe discharge.
So we've gone all the way from A to G. Why is mastering this one skill so incredibly important for your entire nursing career?
Because it gives you a reliable structure to fall back on when you're under pressure, it builds your confidence, and most importantly, it improves patient safety by helping you spot deterioration before it becomes a crisis. You become proactive, not just reactive.
You know, this is a key skill you're going to use every single day. And it's not just us saying it. As it says right here in the Nursing Times, it's considered a gold standard for patient assessment, for a very good reason. So practice it. Get really comfortable with it. Make it your go-to tool. Because once you do, you'll have one of the most powerful skills in nursing right at your fingertips. It's so much more than a checklist. It's a way of thinking that protects your patients and empowers you to be a truly competent, confident nurse.